the Chun Ho Szeto, I hope I pronounced it correctly, coccidioidomycosis cases at the Regional Medical Center in West Texas from 2021 to 2024.
Hello, everyone. My name is Szeto, and I'm a PGY2 IM resident. Currently doing my residency in Texas Tech, a Permian Basin campus. So I'm very honored to be given the opportunity to present our study findings with you guys here, and I really learned a lot from all the research findings you guys share. And honestly, compared to these fascinating research you guys share, our study is relatively straightforward and with a simple methodology. So instead of rushing into the method and research finding in our study, I want to share with you how we came up with this research idea, so much so you can have a better understanding of the challenges we have of dealing with cocci in Texas. So that was actually during my intern year. In the middle of my intern year, we had a very decent gentleman at his 20s, no past medical history, came in with fever, weakness, a lot of pretty typical cocci symptoms, and also a huge right side pleural effusion. We put a chest tube in. We throw all these kind of broad spectrum antibiotics. Patient was still biking fever, was still feeling weak, and the chest tube output was still very high. We didn't know why, and then we sent a bunch of labs, including cocci. I think it's 3 days after the patient got admitted. And then 9 days later, suddenly my attending asked me, hey, did you take a look at the cocci result? It was positive. It's pretty common here. You need to keep an eye on that. And then we knew it was cocci, and then part of me was like, okay, that's residency. I missed something, I picked that up, and then I never miss it. But another rebellious part of me was like, wait, I don't know that's common. No one really told me about that. That's the first thing. And the second thing was, if that's really common, why didn't we have the in-house lab for cocci in our hospital? And then it took almost 2 weeks for us to diagnose a common disease in the region. And I was like, what is that? And then I just look it up, and then and see what's the data of cocci in West Texas. And then there were only 2 studies on the PubMed. And this point, I was not frustrated anymore. I was I smell a research project. So that's how we came up with the project. But after this story, I think we can see the challenges of dealing with cocci in West Texas. The first challenge is almost all the physicians in that region know about that. That is cocci is common in that region, but no one knows how bad that is, because cocci is not a reportable disease in West Texas. And I think I was pretty fascinated by the research project on the coccidioidomycosis in dog, because if you remember, there's a table showing the incidence of cocci among dogs, but in the same page, there's they're trying to show the incidence of cocci in human in Texas, and that's a question mark. So I guess we know better than we know dogs in Texas better than humans in Texas, at least in the context of cocci. So this is the first challenge. We know how bad that is, but we don't know exactly how bad that is. And the second challenge is because of the lack of information, the infrastructure doesn't really keep up. We know cocci is bad, but we don't have in-house lab to diagnose the disease. And I just heard about we treat cocci with the MIC, which was a thing I have never heard about in my program. So I guess the infrastructure in the hospital didn't really keep up with that, and then that makes a lot of problems, including delay in diagnosis of cocci. So that's the background of the study. And to give you a little bit of idea about where this study was conducted, is basically here, in Odessa. So in our residency program, we have 2 teaching hospitals, one in Odessa and one in Midland. So we collected all the Cocci data between like 2020 and to 2024 in the teaching hospital in Odessa. And this region is actually surrounded by a lot of rural counties. So you can see there's like a huge like land here, but basically there's like no man land, like is nothing there. So this is taken from like one of the previous study about Cocci in West Texas, and then that's how they estimate the prevalence of inpatient and outpatient hospital visit in of Cocci based on like a population-based study. And the objective, the aim of this study is to characterize like the basic like demographic distribution, clinical presentation of patients diagnosed with Cocci in our regional center. And our hospital is kind of like a 400-bed regional hospital. And then in Ector County, so there are like 160,000 people in the Ector County, but our teaching hospital, as I said, because it's surrounded by all the rural counties, we also take patients from like all these rural counties, and then we collected all the Cocci cases based on the ICD code B38 and all the subcode under that between like December 2021 and 2024 is approximately about like 3 years time, and we chart review like all the patients we got from Cerner and took a look at it one by one manually. And we defined like rural counties by the size of the population. Every county with like a population of less than 50,000, we define it as like a rural county. So the result is like we were able to identify like 71 patients with coccidioidomycosis, and all of them they're like Texas residents, and around 1/4 of it like they live in the rural counties around like Odessa in West Texas. And you can see like the table here, the majority of the patients, they were like 45% of it were between like 20 to 59 years old, and 31% were over like 60 years of age. Around like 57% of cases, they were diagnosed during the study period, and 10 patients from Ector County were diagnosed with coccidioidomycosis in the hospital in both 2022 and 2023. So if we only consider the inpatients, that would make like an incidence of 6.21 per 100,000 patients in 2022 and around 6.8 per 100,000 patients in 2023. And in 2023, there were like 5 patients from 5 rural counties, because these rural counties, they were really, really small. So if there's like maybe only one newly diagnosed Cocci, that would make the incidence pretty big. So based on the patients we had here, that would make like an incidence of like 10 over 100,000 population in 2023. And this is like the map illustrating all the where our patients live. So as like to mention again, Odessa is kind of like here, and then we also got patient here. This little yellow region is San Antonio, but there's only one case in our entire study from San Antonio. So the result basically show that we have 71 patients with real Cocci in our medical center over like around 3 years time span. And most of them, they have like pulmonary manifestation, like pleural effusion, pulmonary nodule, and cavitation. And around like 1/10 of the patients, they presented with like meningitis, which is a more severe form of Cocci. And the most common comorbidities were diabetes, which is pretty consistent with all the previous data. And around like half of the patients, they have history of smoking. They either smoked before or they are like chronic active smoker. And around 1/2 of it, they have chronic lung disease, including asthma, COPD, bronchiectasis. So our research findings suggested that there's like a high number of coccidioidomycosis compared to the previous retrospective study in West Texas. So actually, there's like one previous study. It was conducted in Lubbock, which was the main campus of Texas Tech, and then they only recorded like 73 patients over 7 years time span. I actually, after I came up with the idea, I passed this study to one of my attendings, and then they were like, no, it doesn't make sense. We have way more there. So that's why we decided to move on and conduct this study. And I think our result is consistent with like my attendings, like impressions. Definitely we have more cocci cases in Odessa Midland region. And then one of the prelim result I got in a side project of cocci, which I'm currently doing, is that actually in the whole Texas, we have the most disseminated cocci cases in the Odessa and Midland region. So it can be explained by the fact that a lot of people in our region, they work in construction, oil field, so that those are like high-risk occupations for coccidioidomycosis. And the incidents we just got, I just reported about cocci is definitely underestimated. First of all, because we only collected all the inpatient data, and then we don't have like any outpatient data, because like the whole healthcare in Texas is so dispersed. It's just we don't really have the whole like access to all the cases of cocci in West Texas. And then also the other reason would be the lack of awareness of cocci in the region among physicians. Again, like the physicians in the region, they definitely know cocci is a thing. It's under the radar, but it's not really, they don't really prioritize them when they have the differential diagnosis. So I like from this study and the findings, I would say this region in West Texas is likely moderately endemic to coccidioidomycosis, and then there's a huge problem of delayed diagnosis and underdiagnosis there. So diabetes, again, is one of the most common comorbidities in the region, and then it's very prevalent in senior group, age group in our study as well. So the limitation is occupational history in our chart is usually not documented. So I cannot confirm if like that is really associated with the high-risk occupation. And again, healthcare in West Texas is very dispersed, and then it's very difficult to get all the inpatient data in just one medical center. So our next step is to build like a coccidioidomycosis database in West Texas, at least including all the medical centers and outpatient clinic within the Texas Tech system. And then definitely we need more epidemiological research to illustrate like a better picture of cocci in West Texas, so then it can in turn, affect the policy making, all that thing. And and I think the physicians in the region, they also need to have a better awareness of cocci, and then include them like early in the treatment, like the differential diagnosis. So I want to take just a few seconds to thank my program director to help me with the this project. And then after I had this data set, I actually didn't really know how to, make use of it, but I reached out to Dr. Donovan, and then she really gave me some very useful advice on how to proceed with all the data sets. So I really want to thank Dr. Donovan as well. That's it. If you have any questions.
So a couple things, very nice. So there was a paper a year or two ago from Texas State Health Department that actually looked at hospitalizations for cocci for the whole state. And you should look at that. Secondly, although we haven't been able, as I talked earlier today, to get the State Health Department to make cocci reportable, El Paso County does report. And I was once driving from Arlington, Texas to Pecos, a town I don't recommend to anyone unless you are engaged in fracking. And we all know here that this is an endemic area. But I actually emailed the Midland County Health Department to ask them, and not surprisingly, I got no response. But you can do that because individual counties in Texas, like El Paso, can report. So I would urge you to contact Midland County, where you are located, and see if you can partner with them. And that may start to do things because El Paso does it. That may get an impetus to get the state to take more interest, which we'd all like them to do.
Yeah, actually, I have already, because the main hospital in Midland County, it's one of our teaching hospitals. So I've already got the IRB and the approval to get the all the data regarding Cocci from that hospital. So we are working on that, but it's a very good approach.
Talk to the health department.
Yeah, that's another thing we can do. Yep.
For fear of agreeing with Neil, first of all, I want to say that was an awesome presentation. I think you did an amazing job. This is a pretty intimidating group of people, so nice job.
Thank you.
Awesome. So I'm going to agree with Neil here. There's about 100 people in this room who want Texas to make Cocci reportable. If you want to rally the troops, we would all back you. One place that you could start is by going to your local health department. One of the things that you said that I found myself thinking, I wonder if that's true. You said that everybody here knows that Cocci is a really common disease. And do they know that in Texas? Because I live in Maricopa County, and I'm not sure that everybody there knows Cocci is a really common disease. And we're the epicenter of the world. So
Janice and we've had cases from Midland. I had a patient from Amarillo. Everyone in Texas knows, and they'll tell you their dogs get Cocci. It is known, just like we've been saying.
So I believe you. And here's what I think you should do. When you talk to your county health department, both California's done it, Arizona's done it, and we will be happy to share it with you from the health department. Sorry, I'm speaking on behalf of our health department. There's a physician's knowledge, attitudes, and practice survey that we would gladly share. We've shared it with we shared it with New Mexico. But I think it would be really helpful to know what Texas clinicians do and don't know about Cocci. What do they need to know? Do they need to know how to treat it? Do they even know that it's not reportable? Would they like it to be reportable? And I think that'd be a really cool place to start. Yeah. And then maybe you could start to build some momentum to get the local health departments to try to push the state health department to make it reportable. Keep doing the good work.
Yeah, I think that's a very good approach. I'll work on that.
I was going to ask a question regarding our last year. I remember Chun mentioned about discussing this with health department. Any outcome of that?
Well, Neil just mentioned the result that we discussed.
So we had an initial conversation, and then I, after member at MSG-ERC in Colorado, so I went back and said I had talked to Tom Chiller, so we had another one, and what we found was this inertia from the state. And that's what I was mentioning yesterday. It wasn't political. It wasn't that, this is a California disease and we can't study it. It was really that I sense that they're overburdened with a lot of other diseases. And this is just another thing. And just think, you had Gaines County. So what is Gaines County known for? Measles.
Yeah.
So Texas is now dealing with measles,
correct,
avian influenza. They have histo in the eastern part of the state. So I think by going to Midland County, I think take your data, talk to them. I think what Rebecca was saying, go local, because we know, and that was something we learned. That was the one thing we learned. El Paso, individual counties, and I forget there's like 143 counties in Texas. It's an enormous number. So, but they can report independent of the state. And just what Rebecca's saying, that may eventually move them, because the whole west part of that state is endemic.
Yes.
I want to add one point. You mentioned about education, and I think educate the physician there to know the impact of this disease. They know the disease there, but they do not understand the impact of the disease there. So diagnosis and education may be very important. And if you need a lecture about coccidioidomycosis, I'm in San Antonio. I volunteer.
Sure. if you don't mind driving like for 4 hours and then come to,
And,
yeah, sure.
and we would hold the next Coxie study group in Midland, but no one here will go.
Thank you so much. It was a wonderful presentation. Thank you.
You
wouldn't
go.